Thank you very much, Prateep, for having me here. So the title is Ensuring Compliance and Adherence. And also, I think there are a few subtitles, and I'm going to talk to you about what we devised as the Non-Compliance Index and what is its relevance in glaucoma management, actually. So compliance and adherence are interchangeable terms. I had to go back to the literature and look it up, actually, how do they differ, actually. So they're often used interchangeably. Compliance has been defined as the extent to which patients' behaviors correspond with physicians' recommendations. And persistence is another term that came up, and that's the total time for which the patient takes the medications, actually. And as a prelude to the difficulties that plague glaucoma management, I want to give you an example that adherence to tamoxifen diminishes to 50% in 2 years in those who have undergone a mastectomy, actually. And that tells you how difficult it is to have compliance from patients when they are on long-term management. And a compliance of 80% or more is considered acceptable, but I would just like to take you with a bird's eye view, because we're dealing with a condition that is so different and that we have to treat in so many different ways. The prevalence of glaucoma in India is calculated at about 11.7 million. Across the world, it is expected to have crossed 60 million. And the commonest means of treating glaucoma is through the use of eye drops. And eye drops are used many millions of times over in a day, actually. And glaucoma medication accounts for a major spend for the patient and a major earn for the corporates, actually. Non-compliance in the use of drops is an important cause of concern, and it was the purpose of this study to determine the pattern and prevalence of non-compliance in glaucoma subjects and to understand its correlations with other ocular and systemic parameters, actually. So we included 23 subjects with a mean age of 56 years, and 21 of them had primary open-angle glaucoma, and 11 of them had undergone previous glaucoma surgery. All of them underwent an ophthalmic evaluation, and we devised a non-compliance index that was determined based on non-compliance history for the last 90 days. I think most of you would have asked your patients that were you using the drops regularly, and you know the kind of expressions and the answer that you get, that they leave you completely puzzled as to what it is that the patient is going to try to tell me about the compliance, whether he really used it or not. And so we thought this was just a little bit more objective than merely asking a patient. So the number of non-compliant days was divided by 90 and multiplied by 100 to get the non-compliance index. So for example, 3 days of non-compliance divided by 90 into 100 was 3.33. So that means it's very, very good compliance in a sense, actually. The mean vision was about 0.68 decibel units. The mean sensitivity was 16 decibels. The mean defect was 11 decibels in our patients. And the retinal nerve fiber layer thickness globally was 56 microns, actually. The mean non-compliance index was about 5.7. Actually, that's very good, actually, that these patients are telling us that they were very compliant. That is a little bit hard to believe from what is there in the literature, but you have to take what the patient tells you at face value, and the range was 0 to 33. So these are the medications that the patients were on. And when we tried to correlate, we did a bivariate correlations of the non-compliance index, and we found that the higher the non-compliance index, the lower the visual acuity, the higher the chances of the nozzle touching the eyelashes, and there was an increasingly abnormal technique of drop installation. I will show you the 15 parameters that we questioned the patient on, actually. And the non-compliance index also had a correlation with the retinal nerve fiber layer thickness, that the retinal nerve fiber layer thickness was less when the non-compliance index was higher, actually. But we were not able to determine in this small study a correlation with age, gender, weight, height, vision, previous glaucoma surgery, total number of drops used, and also with mean sensitivity and mean defect. So it obviously there is an indication that the number of cases need to be a little bit more, but nevertheless. So this is a case of a 60-year-old lady with primary open-angle glaucoma with a BCVA of 6.9 in the right eye and 6.18 in the left eye, and a non-compliance index was 33%, actually. Patient was using beta blockers and alpha-GAN. And this is the video of how she was putting the drops, and I would like to explain to you that there were 14 parameters that we studied, and then we categorized them into scores of category 1, 2, 3, 4, depending on how many parameters she was abnormal with actually. And so based on that, this lady had a grade 3 category. So she had a moderately abnormal drop installation technique actually. So you can see that there are many, many things that go into putting a drop. It's not just telling a patient to put the drop. And I think that what we have discussed and emphasized so many times, that teaching a patient how to put drops is perhaps very important in your management of glaucoma actually. And this is another study of a patient who was 14 years old, and he was diagnosed to have congenital glaucoma. He underwent trabeculectomy and trabeculectomy in both eyes, and the patient is currently using prostaglandins and Combigan eye drops. And this is the drop installation technique. His father, who takes really good care of him, was doing it for him all the time. And so you got an eye drop score of about 4, and so it was mildly abnormal. That means in only 4 parameters he was not doing well, but generally he did very well actually. So the study showed that the non-compliance index was about 5.7, and this appears to be an acceptable non-compliance index over the last 90 days. It's interesting to note that it correlated with an abnormal technique of drop installation on the whole actually. So teaching the correct technique of drop installation will actually make the patients more compliant. And that drop installation may be a challenge to many elderly patients who suffer from glaucoma. That is something that we generally know actually. So how do you improve compliance and adherence? So there are issues of accessibility, affordability, education, awareness, explanation, language barriers, reminders, follow-up, family support, and counseling. And we do seem to have come to the conclusion that as glaucoma specialists, perhaps we need to hire a pharmacist who will spend time with the patient, telling them about the drops and teaching them how to instill drops actually. And this is something that I got from a publication from Alan Robin and his colleagues in the Indian Journal of Ophthalmology, and that you need to ensure that the patient understands the disease process, the benefits and risks of treatment, the need for a specified regular dose, the need to record compliance, and the need for regular follow-up appointments. That the more the patient comes for a follow-up, the more compliant he's going to be and the better he's going to learn to take care of his glaucoma management. Thank you very much, all of you.